It is clear that the Spanish flu certainly touched ground in America, setting off a large outbreak on Fort Riley, Kansas, the former headquarters for the cavalry forces and home for Army veterinary medicine. And even the U.S. Army today admits that Fort Riley is believed to be the origin of the worldwide epidemic that killed millions. Probably the greatest pandemic the world had ever seen, greater than the bubonic plague in the 14th century, killing between 2 and 4% of the world's entire population, according to Robert Smith, the director of the Museum Division on Fort Riley. And they acknowledge that the pathogen was the H1N1 avian flu, as most agree, and at least the current account reports that the patient zero was an Army cook named Albert Gitchell, who was the first recorded infection of what would become hundreds on cap. First in a total of 107 in the first days, to be exact, as recounted by Lieutenant Elizabeth Harding, the first head nurse from the Nurse Corps, established in 1901 by a Fort Riley alumni, Surgeon General George Miller Sternberg, and Lieutenant Riley, who eventually became Lieutenant Colonel before she finally retired, served under Colonel Edward Schreiner, the officer in charge of the Army Hospital. But it is believed that he had acquired the disease, our little cook, from draftees from Pasco County, Kansas, who are believed to have gotten the disease in a zoonotic evolution from pigs. Others have pointed to Haskell County, Kansas, because of its intersection with the migratory routes of at least 17 species of birds and wide availability of hog ranches. It is clear, according to NIH, that as many as 60% of the approximately 45,000 American troops who are claimed to have been Spanish flu fatalities were new recruits who had joined the Army within just the past 4 months, a virus that found high risks for fatality amongst the elderly on one end of the spectrum and children on the other, but also young, otherwise healthy people between the ages of 20 and 40, or approximately the military service age. A study, even co-authored by Anthony Fauci, concedes that while bacterial pneumonia at least delivered the final punch in the majority of cases for the H1N1 viruses that had infected and debilitated them, in the CDC journal, Emerging Infectious Diseases, the pneumonial bacteria introduction has been attributed to masks that the patients were required to wear, making for an interesting dodge of claims by fact-checkers as to whether Fauci at NIAID knew that masks contributed to the deaths of the Americans that the CDC says happened. No credible research, however, to date endorses the claims that meningitis vaccines by the Rockefeller Institute in any way contributed to the bacterial pneumonia that was associated with most of the Spanish flu deaths, especially since meningitis, which can be caused by viruses, bacteria, or even fungal inflammation, is a disease condition that affects spinal and brain cells with no bronchial manifestations at all. But for a credible report that appeared in The Guardian, the assurances of NIAID that bacterial pneumonia was the straw that broke the camel's back in the majority of fatalities, the admission of the CDC that the bacterial pneumonia was probably caused by the masks the soldiers were required to wear, the acceptance of the Army as Fort Riley as the original location of the outbreak in Kansas, the locus of at least 17 migratory birds, the repository for an avian flu to precipitated zoonotic evolution, and the 60% of new recruits who were reported to have been fatalities to this H1N1 mutation variant, contributing to the narrative that the pandemic spread from Kansas to Europe with the troops going off to war. The 2-year run for the Spanish flu from 1918 to 1920 would be neatly described, but this report suggests that the Spanish flu-like symptoms first appear not in 1918, but a year before in 1917, again associated with a bird migration path causing hundreds of casualties amongst troops, but not in America, but rather in France. According to The Guardian, a theory favored by British virologist John Oxford is that the pandemic began in Etaples, a huge British military camp an hour southwest of Boulogne. According to that news account, with accommodation for up to 100,000 soldiers, Etaples lay on a migratory bird flyway close to the Somme estuary and had all the necessary conditions for a spillover event. Wild waterfowl, plus chickens and pigs living in close proximity to men packed in airless barracks. Metropolis also had several hospitals where soldiers whose lungs had been compromised already by mutagenic gases deployed on the battlefield were evacuated for treatment. According to this account, in the winter of 1917, several hundred British soldiers collapsed with influenza-like symptoms, and medics at Metropolis recorded 156 deaths. At the same time, the epidemic was labeled purulent bronchitis because of the yellow pus that oozed from the larger airways of the lungs at autopsy. Some medics thought it resembled the lung damage from phosgene gas. This raises the question as to how the migratory birds infected with the avian flu 1 year later might have arrived in Kansas to set off the outbreak that then traveled back with the relatively smaller number of troops who were already fighting in Europe. Or why, if it were a double zoonotic evolution, it would require the arrival of the American troops a year later to set off the mass casualty effects that became the Spanish flu pandemic. This report also draws attention to one prominent feature in the pneumonias that contributed to the fatalities, an asymptomatic sign identified as cyanosis, a distinctive purple-blue discoloration of the lips, ears, and cheeks caused by the loss of oxygen to the heart, a hallmark of the pneumonias identified in research published by doctors in The Lancet back in 1919. But there is another aspect even far more intriguing in a current pandemic in comparison regarding the global effects of that pandemic pathogen with a definitely validated, highly contagious pathogen estimated to have caused the deaths of between 50 and 100 million people worldwide in just 2 years, before winding down to a less virulent condition later to reemerge and even be declared a PHEIC, or public health emergency of international concern, within recent years. Even with crude treatments in medicine, like gargling salt water and self-isolation, which we still use today, a treatment reserved for the most essential of persons, like King Alfonso XIII of Madrid, and a pathogen that even managed to infect the president. But unlike in the movie Failsafe, this president actually had a name. Most know today as Woodrow Wilson, one of the founding forces for the League of Nations, based in San Francisco. Ironically, the repository for much of the research on the novel coronavirus, and second only to New York, the location of the largest Chinese American population, both of which cities, along with Los Angeles and even 4.3% Chinese American population Hawaii, a novel coronavirus somehow averted during the initial travel migrations that introduced COVID-19 to the United States, a slight aberration in travel that would be expected normally.
I am the Matador.
This briefing has been unclassified. That concludes this brief. My name is Major Mike Webb, and by God, I am running for governor of Virginia. I ask every Christian, every conservative, every Republican, every Virginian, and every American true to, like the motto of the infantry, follow me, and we shall overcome. Honest. And y'all come back now. Here. This advertisement was authorized by Mike Webb.